I should have asked if the sound is up. Very good. All right. Good morning. Thanks as always to Jay and Vicki for being here to help us interpret. So it's Thanksgiving Eve, and we have much to be thankful for. There's some reason to believe that our efforts are beginning to show results, but cases are dramatically high. So we have plateaued a bit, and Greg's going to get to that. We've plateaued at a really high rate, unfortunately, but at least we have plateaued. So this week was better than last week. Things change quickly, as you all know, and behaviors drive all of this. But at this moment in time, we're on a plateau. So that's the good news. Yeah. So I'm going to talk quickly about the numbers, and then Greg obviously will elaborate. So as of today, we've had 29,931 positive cases of COVID-19 in Hamilton County. The difference, or the increase from last week, is 3,865. So again, we've plateaued, but they're pretty high numbers. The number of hospitalizations is up to 1,597. The increase from last week is 107. And our death rate is at 372. We have lost 9 people since last week from COVID-19. Something that happened last week after we had the briefing, and I just want to mention it, the Health Commissioner, Greg Kesterman, issued a public health advisory. It was a bit of a stay-at-home advisory to recommend that people stay home as much as possible to reduce the spread of COVID-19. The county commission then, all 3 of us, passed a resolution in support of that health advisory. And from my perspective, the idea is to remind people, safe practices: wash your hands, wear the mask, stay at a distance from one another. But there's this added, 4th layer where we're encouraging people to think about their COVID footprint and to reduce their exposure as they move through their daily lives, particularly heading into a holiday. And so that, to me, is my interpretation of what we're trying to accomplish with this advisory. I will let Greg interpret for himself. But as the commission, we just wanted to make sure that we were supportive of public health in this community and advising people to do what we think is the smartest and best thing to reduce the spread in Hamilton County. So, I should say that the health advisory, we were not alone in issuing that. We were joined by other major counties throughout the state, including Franklin, Cuyahoga. I say that slow so that Jay can spell out Cuyahoga. Cuyahoga, thank you. Summit, Montgomery. There are other counties that did the same, actually many counties. So we're in good company there, but just wanted to remind people that we're under that health advisory. So tomorrow, Thanksgiving, we face a challenge, but I think also an opportunity to do things a little bit differently this year and try to keep ourselves and other people safe. So people have been sharing their ideas and their stories with me. I kind of put out the call last week about, hey, what are you doing for Thanksgiving? How can we offer ideas for people to celebrate safely? And so I just wanted to share a couple of the stories that I've heard. So Kimberly Lee, who works for Commissioner Summer Dumas, she says, I will be attending an early morning virtual Thanksgiving prayer breakfast with my church. We cook our food at home and enjoy via Zoom. I will prepare Thanksgiving dinner for those in our household, followed by Zoom with my out-of-town children and grandchildren. Bridget Doherty, our communications director, is attending a family Zoom with her nieces who have prepared a pageant for everyone to enjoy on Thanksgiving. I love that, Bridget. My assistant, Fatima Ba, is keeping her gathering small. It'll be her husband, her 2 kids, and her parents. My chief of staff, Alex Linzer, who generally has a very large family Thanksgiving, has canceled the big get-together Instead, he's doing a video chat with his parents and having dinner with a family from his neighborhood for whom his wife provides childcare during the day. So that's the bubble. James Wolfe, who's the mayor of Mount Healthy, says small sacrifices can save lives this season. For over 30 years, my extended family from across Cincinnati and beyond have returned to the Mount Healthy Park on Thanksgiving morning for a friendly game of football. 4 generations of the Wilger family have experienced this tradition, and for some of us, this is the only time of year we see one another. Though it disappoints everybody, we have decided that it's more important to keep each other safe and healthy than playing football and risking the spread of COVID-19. Thank you, James, for sharing that story. And as you all know, I'm doing a Zoom with my family. We're intending to play euchre, and I just want a big shout out and thank you to those of you that heard me say that last time and sent me apps to allow that to happen. One of my family members is in charge of this. Thankfully, it's not me. But thanks to everybody that gave me those apps for card games that you can use via Zoom. So today, so as I said, you know, we've got relatively good news. I mean, our numbers are super high, and Greg's going to talk about it. But we're making a little bit of progress here, and I don't want to lose sight of that, especially as we go into a holiday where I hope that people will kind of heed the warning that this could be either a really great holiday where we've changed our behaviors, or not so much if people don't heed the warning. So to that end, we do have a special guest, not that Greg is not a special guest, but we've got an additional guest this morning. Her name is Dr. Megan Rich. Megan is a member of the Commission on Women and Girls for Hamilton County. She is also a family medicine practitioner and a medical school professor. She's a frontline medical provider and is going to speak about the healthcare workers, what healthcare workers are going through right now, and the importance for the rest of us to do what we can to protect them. But before we get to Megan, we're going to turn to Greg for information related to the numbers, the data, and the health advisory.
Thank you, Commissioner, and good morning. So over the last 7 days, we have seen a slight slowdown in the number of new daily cases. As Commissioner Driehaus just indicated, our numbers are still really high. We're just not seeing each day a new increase in the number of cases over the previous day. I'll talk more about that in a moment. I do always like to start off with reminding people that Hamilton County has great access to testing. So if you want to get a test, please visit our website, hcph.org, and you can find a map of testing sites, as well as a link to the Health Collaborative's Test and Protect program, which is funded by Hamilton County. There are new sites every day, and sites are all geographically located throughout the county. I always recommend you look ahead of time to make sure you know what you need to get tested. And I also like to point out that if you get tested and you're symptomatic, please stay home. Don't leave your home until you have your test results and they're negative. It's important for slowing the spread of COVID-19. Let's take a peek right now at the case numbers for Hamilton County. As mentioned, for over a month, each week I would stand at this podium and share that we've had our worst day on record. Today is the first day in a month that I can say that's not true. I'm happy to report we have seen a slight decline in the number of cases over the last 7 days. You know, we've had a really long month, and so while I'm very optimistic that we've started to make a change and a trend, I think it's too soon to start letting our guard down. We clearly have a significant issue and a lot of COVID-19 within our community. So the time still right now is super important to be careful, but I like to share that positive trend for the moment. When looking at the cases in our community, they are still coming from all over. We have seen all age groups with a lot of activity. The 18 to 29-year-olds continue to have the most cases. They still have about 815 cases over the last 7 days. In addition, the 70 to 90-year-olds have 333 new cases. As you can imagine, this age group tends to have more significant illness associated with COVID, and so that can have a negative impact on our hospital systems. Shifting to the reproductive number, for the last month and a half, our reproductive number has been above 1. Today it is at 1, and yesterday and the day before it was just below 1. So this number is an indication that right now things are calming down, which I would like to continue to see that trend happen over the next several weeks. What happens tomorrow on Thanksgiving will play a role in what happens with cases. So as we're making plans and thinking about tomorrow and Thanksgiving and seeing friends and family, I'd really like to further encourage us to just be as cautious as possible. So as I share some calm and relief in the numbers, looking at our hospital data really needs to continue to keep us all on edge. While my team doing contact tracing has had a week of relief, those working in the hospitals, our doctors and nurses and other staff, have had a very busy week. Cases continue to rise in our hospitals. In Hamilton County, we have had elevated cases over the last week or two, but when you look at the 14-county region, we currently have 650 patients in our region's hospital systems. This represents an 8-fold increase in the number of COVID patients since the beginning of October. Remember, this is a delayed indicator, so we will not start to see a drop in hospitalizations probably for a couple weeks if we continue to see cases decrease. So it's super important that we remember our hospital workers this Thanksgiving, as they have a very busy day ahead of them managing care for people who have gotten sick. Thinking about the intensive care unit admissions, we have seen a 6-fold increase since the beginning of October. We are now at 150 patients in our region's intensive care units. So in wrapping up today, I'd like to talk a little bit about the public health advisory that was issued last week, and I appreciate the support of our county commissioners chiming in right behind me with a resolution supporting that. It's really an important tool to remind our community that we have a lot of community spread right now. The advisory recommends people limit travel. It recommends staying home as much as possible. I know lives are continuing, and the advisory is not asking us to quit working or quit going to school, but it is a reminder that right now we must do what it takes to continue to lower our spread of COVID-19 within our community. I'm asking each one of you to make one additional step in your daily lives to help slow the spread. You know, there's some basic things that we've been talking since the beginning of the pandemic, like wearing a mask. Maybe wear that mask in spots where you wouldn't have normally. Each little thing that we do will make a difference. I wanted to say in conclusion, happy Thanksgiving to everyone. My hope is that each of you realize that our choices tomorrow and beyond will have an impact on the health and safety of our family and our community. While we will each make decisions on what level of risk we're willing to take tomorrow, I think we should all really have that plan that Commissioner Driehaus and I have been talking about. Minimize the number of people, try and do things outside, and please wear a mask, even if you decide to have family over. That mask can help slow the spread and the amount of aerosolization of COVID-19. So I'm really pleading with everyone to have a safe holiday tomorrow. Realize tomorrow might be a little bit different than other Thanksgivings, but for the first time, we actually see a vaccine in sight. There's an opportunity that next Thanksgiving will be back to normal. So please keep everyone healthy this Thanksgiving. Wear a mask, social distance, and wash your hands. And I look forward to continuing to work together as a community to end this pandemic. Thank you.
Thank you, Greg. So as Greg mentioned, we have an unprecedented strain on our hospitals because of COVID-19. It's very concerning. I'm trying to be optimistic this briefing, but it's very concerning. And we're hearing very desperate stories coming out of the hospital system, the Health Collaborative. Dr. Lofgren talked about it. And so recently we had a meeting of the Commission on Women and Girls, and we talked about a variety of things, the impacts of COVID on women and girls in our community and some of the other things we're working on. And Dr. Megan Rich asked for just a couple minutes at that meeting just to convey what she's seeing on the ground as a healthcare provider in this community. And so she spoke to that at the meeting, and it was really powerful. And so I've asked Megan to, or Dr. Rich, I should say, to convey that message here to the broader community so that we all can remind ourselves of the strains on healthcare workers and what we can do to try to reduce that strain out of gratitude for the work that they're doing. So Megan is joining, Dr. Rich, I'm sorry, Megan, is joining us virtually. And so Megan, with that, I'm going to turn it over to you.
Thank you. Thank you, Commissioner Driehaus, for giving me this space. I'm glad to have a platform to share a little bit about my story. And just to be clear, I am not part of our hospitals or the university's COVID response team, planning team. I'm just a physician. And I'm a family doctor, which I think gives me a little bit of a unique viewpoint because I'm positioned in the community. And so I'm hearing the conversations of the community, but I also, as part of my job, work in a hospital, including working on COVID floors. And I feel like there's just a little bit of a gap that how the community is talking about COVID and the behaviors and choices being made, and how I hear health systems talking about COVID. Because really, when I hear the health systems and what they're planning for the remainder of this month and into December and maybe even into January, it sounds like disaster planning. It sounds like preparing for that tidal wave of patients that we expected to happen last spring. And we were very fortunate that we didn't get hit here in the Midwest the same way that our friends and colleagues on the coast got hit. And so I guess I just want to try and be that bridge to connect both of those, both sides of that story. So I'm glad we got to see the graphs because I look at those graphs on a regular basis. And while I've felt a lot of things as a healthcare provider, feeling frustrated with the system, I think is often par for the course. Feeling stressed is a routine part of my job. Feeling worried or anxious has been pretty common during this pandemic. This is the first time I've been afraid. This is the first time that I've really felt fear as a part of my job. Looking at that graph and then also seeing that reality lived out in our hospitals. So what I'm seeing when I work in the hospital is ICUs that are close to or overflowing, meaning that patients who need critical intensive care are being cared for in a less than ideal setting because they're on what we call a regular floor bed, meaning, it's for routine medical care for, routine hospitalizations and not that kind of intensive care that you would get in an ICU. And that's really stressful for doctors, for nurses who are trying to take care of these patients. And I see that stress kind of wearing on people. My colleagues, my ICU colleagues, they look haggard. They look worn out. And that's because everybody's working longer days, and not just the doctors and the nurses, but also the respiratory therapists and the pharmacists and the social workers, everyone who goes into that hospital team. They're not taking holidays. They're not taking days off. There's no weekends. There's no vacation. It is just realizing that this is an all hands on deck situation, and it will be all hands on deck until it's not. And I'm worrying about them. We are seeing an increase in deaths, and that takes its toll too. And those aren't necessarily even COVID-related deaths. I think what's been striking is in the past couple of weeks, we're seeing some of patients that we've known for a really long time. We're seeing patients die of things that aren't COVID-related. And how much is that just, related to the stress of things going on, of this pandemic on our community? Those deaths also just take their toll on you. And then I think we're also kind of grappling with our own mortality. I think it's fair to say that for doctors, nurses, and others in healthcare, there's some inherent risk to the job, and we all knew that going in. But this virus is highly contagious and has a higher mortality rate than most infectious things we deal with. And so I think I at least find myself reflecting on my own mortality quite a bit now as I go into these COVID positive rooms. And I think about my kids. I have two school age kids, and man, I sure want to be there to usher them into adulthood to the best of my ability. And so while I think, if I'm allowed to speak for everyone in healthcare, which maybe I'm not, but I think we're willing to be the healthcare heroes that this community needs, and we're willing to work the extra hours and to take those risks. But I think that gets really hard to do on our own. We need the community, and I'm glad to see the graph leveling off, but whew, man, those are still really high numbers. So we need your help. And that's kind of my plea to everyone in the community to do those things that we just heard about, right? To mask up, and to remember that masking up is not just covering your mouth. The mask should come down over and cover your chin, and it should cover your nose, right? There's no partial credit for kind of sort of wearing your mask. You got to wear it correctly when you're going out, and make some choices to not go out. Try not to access things that you don't urgently need. So, obviously, if you need urgent services, grocery supplies, we of course want people to access those. But it is time to hunker down, to stay home. It's not too late to cancel Thanksgiving plans and to change those plans to be more of a virtual gathering. We need help, and really this is what it looks like to take care of each other right now. And I know that's different than how we've usually cared for each other in a community in the past, but we need to be socially distanced, or I guess maybe physically distanced, but hopefully with that social solidarity still coming together just in a different way. And I guess I just want to say thank you. I'm hopeful that, if I tell 3 people and then those people tell 3 people, and that goes on and on, that maybe it'll be enough that we can turn this graph into a true downtrend and avoid the disaster that I'm just so worried is coming our way. Thank you again for listening.
Thanks, Dr. Rich. Really, really appreciate you helping us better understand the perspective from a healthcare professional, or frontline worker, really, in the trenches every day. And I love that you use the word solidarity, because that's how I feel about this, that we are in solidarity with one another, with healthcare workers, first responders, with our families, with our colleagues, with one another, to try to reduce this trend. I wanted to, as I said, try to remain positive about the plateau, and it is good news, it is. But the number is extremely high because we had many, many weeks of our highest numbers ever. So we're definitely not out of the woods, but if we could create a trend where we're plateauing and then moving downward, that is exactly in solidarity what we're asking people to do. So with that, Bridget, I think we're ready for questions for any of the 3 of us.
Thanks, Commissioner. Todd Dykes with Channel 5 is up first. He has questions for Dr. Rich and for Commissioner Greg Kesterman.
There we go. Sorry about that. I was muted. Good morning to everyone. I would ask Greg and Dr. Rich, it's good to see you both. Thanks for taking part. Seeing reports that the CDC may recommend shortening the quarantine guidelines from 14 days currently to 7 to 10, and then with a test at the end and so forth, the idea that maybe there would be more compliance with quarantining. I just like to open it up to both of you, your thoughts about that. I know it's obviously a CDC decision, and then it would come down to our level, but would that make compliance with contact tracing better, or just open the floor? And what do you think?
So from a county public health perspective, first step is the Ohio Department of Health would have to change their standards. So even if the CDC changes them, we would look to the Ohio Department of Health for their guidance. I do concur that if we could, for example, reduce quarantine time significantly, or isolation time significantly, it would make it easier on families and individuals. And so from that perspective, I think that would be a good thing. So it's very early. I just read the article last night about it. And if the science bears truth and the Ohio Department of Health makes change to align with the Centers for Disease Control, I think it would be a good thing.
And Dr. Rich, would you mind picking up on that real quick to share your thoughts?
Yeah, definitely above my pay grade, but I can appreciate as a working mom just how hard it's been to balance both work and home, and trying to homeschool kids or virtual school kids, and when kids are going to school, also getting sent home with symptoms, and so I'll follow whatever the guidelines that are set forth for me, but I can definitely appreciate the position people are in, and would love to have rules and guidelines in place that make this as easy as possible to follow.
Thank you.
Next question comes from Ann Saker with the Inquirer for you, Greg.
Good morning, Ann.
Good morning, everyone. Thank you so very much for taking my question. Two things. First of all, Commissioner Kesterman, how confident are you that this slight downtick in the numbers is a real thing and not a consequence of some of the data delays that the state was experiencing earlier this week and late last week? And secondly, how's the contact tracing going? And are you still able to do the tracing where you're finding out where someone got infected and not just the downstream contacts?
Well, thanks for those questions. I'll start
Thank you.
from my perspective. The data, we at the local health department level get our data oftentimes directly from the laboratories. So when they have a positive test result, the Ohio Department of Health, through orders, have required that COVID-19 cases get reported directly to a health department within 24 hours. I believe that process is working, and I don't actually believe there's any slowdown in reporting to the health department. So when I say my team feels better right now, last week we were closer to 400 cases per day that my team was having to manage. This week we're closer to 330 cases. So my team is actually, for the moment, breathing a small sigh of relief. In addition to the number of cases being elevated, we went from 300 cases to 500 cases in the matter of 2 weeks. That clearly put a strain on my team. However, we've responded, as you've heard me say, we've trained many of my team internally. We responded by using some of my internal staff to help. And then actually over the last week, we've actually hired 15 additional contact tracers. So it's a battle, and we have to keep adjusting and be flexible, and my team has done so. So we are still responding to each positive case. We are still making contact. We have shortened our survey a little bit. So for the time being, I am not asking the question which large gatherings you have attended. And we have done so to make sure that we have the capacity to hit every person and to have a quality survey with them. At some point, I will most likely add that survey back in. But as I've shared, that survey is just really providing a location that somebody has been in the last 14 days. It's not suggesting that they got sick at a grocery store or that they got sick at a bar. It's just one tool for saying, some people are more willing to go to more types of locations. And as we just heard Dr. Rich say, right now is the time that we are asking, from a public health perspective, from a medical community perspective, people to hunker down and to slow things down so that we can get through this pandemic.
Okay, just to follow up here, Greg, so that I'm understanding, when you're contacting a positive case, someone who has a positive test result, are you focusing more on their subsequent contacts, or can you also have the time and the energy to do, where might you have gotten this?
So we absolutely are focusing and have always focused on who they have been in contact with within that 48-hour period prior to their symptoms starting, or if they're asymptomatic, their test date. We have never been very good with COVID-19. No health department in the United States has been very good at saying where you acquired COVID-19. And that all comes down to that infectious period. If I'm exposed today, I can become sick anytime between 2 days and 14 days from that exposure.
Right, so what is the value then of not asking the question about large gatherings? Is it just you can't trace them all anymore?
No, the value of me eliminating that question is that question wasn't changing our behavior. It was really a data point, and it's saving my team 5 minutes per survey. If somebody said they attended 3 or 4 gatherings, we started gathering data about that so that we could have a bigger picture. But it's not saying that they got it from that location.
Okay, and one more thing, I'm sorry, one more question. There was an Axios poll that came out today that said 1/3 of Americans are not changing their behavior for Thanksgiving. Are you just relieved that 60% are changing their behavior, or does that 1/3 pose a problem?
On Halloween several weeks ago, I was really disappointed when I was out and about with my children at the behavior of our community. And I worried that we would see spikes and cases climb in a way that we hadn't seen. And to be honest, that played out. We have had more cases over the last several weeks. It could be a result of Halloween, it could be a result of the colder weather, but we've had more activity, and it's clearly a result of us as a community taking a break from what we've been advised to do and to hunker down and to be careful. So as I look to tomorrow, I am scared that we will see a skyrocket of cases as a result of behavior on Thanksgiving that can lend for the spread of COVID-19. I'm very thankful my team got a little break, and I'm worried that in 2 weeks we'll see cases at a higher level than what we're seeing them currently. Remember tomorrow, as you're gathering with grandma and grandpa, they are the vulnerable population, right? Somebody who's 40, somebody who's 20, we typically don't get sick. And when we do get sick, it's typically like a flu. But when you're talking about grandma and grandpa, they get sick in a different way, and they often end up in our hospital systems. And there's this misconception that people in the hospitals all have comorbidities and things that make them sick. But the truth is, you can get sick with COVID-19 very seriously without having another illness or without being obese. And so right now is the time to be careful.
Question comes from Scott Wortman with the Inquirer.
Hi, Scott.
Good morning. Since the curfew went into effect, what does enforcement look like? What are you seeing in terms of complaints, and how are you responding to them?
So interestingly, I don't believe our agency has received any complaints associated with the curfew. We are still getting complaints from a variety of sources, although as you know, the director order that adjusted retail compliance, the complaints for retail businesses are currently being redirected to the Bureau of Workers' Compensation. So once again, my team actually is not responding to those. We're forwarding those on at the request of the Ohio Department of Health. We still see complaints about restaurants in a variety of locations, and we still follow up with those, but I've not had anything associated with the curfew.
And to piggyback on what my colleague Ann asked, and I'm not sure if I apologize if I missed it. When you look at you talk about the plateau and the increase of cases, is that a statistical anomaly, or is there a reason for that, do you think, or?
So we see cases as they come. I mean, the raw numbers coming to us, there's no statistical analysis done on them. These are just the raw numbers that we have to respond to. And, often, I'll have, 2 weekends ago, I had my worst day on record with 494 cases that my team was responsible for. And the next day it might be 380 cases. That's just an example. Those differences are very different than the 7-day trend that we're seeing right now. The last 7 days in general have had less cases than the week prior.
And do you think there's a reason for that, or is it just the ebb and flow of numbers and uncertainty? Or
I don't have a great reason, although I would like to believe that some of the messaging that we have done from this podium and some of the messaging that other partners have done have had some impact on changing of behavior. In the last week, if I've run to the grocery, I've at a couple stores seen people actually working at the front counter. A week and a half ago, I went to a soccer venue, and young high school workers asked 2 gentlemen to wear their mask, at which time they refused, and the workers actually followed up by asking them to leave if they wouldn't wear the mask, at which point they refused once again, and the young high school workers called the police, and the police removed the 2 individuals. That type of change in how our businesses are reacting will make change long term and help us get to the point where we have vaccine and can make our community safe. But I think more businesses need to treat COVID-19 serious right now. And you've heard me say this many times, the successful businesses in my mind are the businesses that are adjusting and making their customers feel safe.
Looking at hospital capacity and ICU capacity, how close, if at all, are we to having to look at the convention center again for overflow?
So I would probably defer that question to a different briefing when a member from the Health Collaborative is here. In the briefings that I have from my hospital colleagues, they have many internal plans that they would like to utilize first. For example, Dr. Lofgren stood before us at this forum and indicated that there are some opportunities to open up other types of clinics within the hospital systems as they're more comfortable than a concrete floor at the Duke Center. But that plan still exists. Nick Crosley, our EMA director, still has supplies ready to stand up and to bring that plan to life. But at this current moment, I think they're trying to work within their systems.
Do you know how close to capacity we are right now?
I do not have a concrete number on that, but as we just heard Dr. Rich say, even though we're not at a point where we need to go to those other plans, we know that when Dr. Rich shows up and looks at the intensive care unit, people are shifting and in different spots, and things aren't normal anymore in the hospitals. They're staffing things differently and they're managing things differently. So that number does exist, and I think if you reached out to the Health Collaborative, you could get an exact number.
Thank you.
Our next question comes from Corey Sharber with WVXU for both commissioners.
Hi, Corey.
Good morning, everyone. Thanks for having me. I just want to ask Greg real quick, with hospitalizations going up in the Region 6 hospitals, there's also been worry about hospitals filling up in Northern Kentucky. I'm not sure of the relationship between the two areas regarding hospitals, but how much strain can that put on Hamilton County if those hospitals in Northern Kentucky end up filling up?
So our hospital system, when you look at the slide that I share, it's actually a 14-county region that we're looking at, and it's slightly different than when you look at the Ohio Department of Health's region. Our region actually does include Northern Kentucky and Indiana as well, and it's for that very reason. We share resources. People and diseases travel across the Ohio River, and so our systems need to be prepared to help out with them as well.
I have a question for Denise. I wanted to know real quick if you guys are concerned about the amount of air travel that's going on right now. The TSA Friday through Sunday reported over 1 million people going through security checkpoints, which of course is the most since mid-March. Are you guys keeping track of air travel going between the different airports within the region? And does that cause any level of concern for cases going up?
Yeah, I think we're all concerned. We're concerned about the individuals that aren't not heeding the advice of public health, whether it's air travel or, getting together as they normally would with a whole bunch of people in their homes without masks. Yeah, we're worried about that. Hopefully, a lot of people have altered their behavior, and you just heard a bunch of anecdotal stories about individuals that have altered their behavior. So, that's what Greg has been saying for weeks now. That's what I've been saying for weeks now. Please make a plan to do things differently. But the concern is that not enough people will heed the advice, and we're going to have a tremendous spike after the holiday. I think the message today is it's within our control to keep that curve flattening out. But yeah, I think it's fair to say that we're concerned that that might not happen and that the numbers are going to go up.
Thank you. I just had one more question for Dr. Rich. You spoke about there being a gap with the community talking about COVID-19 and the actions the community is taking regarding COVID-19. Could you speak more on that? Exactly what instances of actions have you been seeing? And also, have you seen inaction being taken as well?
Yeah, and I don't have any great data for that, right? This is just my perspective. But my perspective is, as I have, been in my community, I live in Clifton, and just listening to my patients from a variety of communities and neighborhoods in Cincinnati, my sense is that they're a little unaware of how bad things are getting at the hospitals, that it kind of seems like talk of, business as usual, which is not where we are in healthcare. We are contingency planning like mad, trying to come up with the best plans possible and preparing for, because the hospitalizations are delayed, right? So after you have a lot of public meeting and this infection gets spread, it takes a couple of weeks before we see the increase in the hospitalizations and hospitalizations requiring ICU care. So we are planning for mid-December to not be in a very good spot. So that's, I don't know if that answers your question at all, but that's kind of what I've been feeling like I'm seeing from the community. Unawareness.
That's all. Thank you very much. That's all the questions I have, everyone.
Great. Our next question comes from Larry from WCPO. He has questions for Dr. Rich and Commissioner Kesterman.
Mm-hmm.
There's a discrepancy in the positivity rate of coronavirus cases in Ohio. the Department of Health here says it's less than 15%. Kentucky says it's more than 15%. My question is, does that matter, being that we're on the border? Why? And what significance lies in that 15% positivity rate number?
So here in Hamilton County, I pretty much solely refer to the data that is pulled together through the Health Collaborative, and I feel very strongly that that data is accurate and calculated correctly. Here in Hamilton County, it's been a day or two since I've looked at it, but on average, positivity rates are about 12% in the county as a whole, closer to 15% when you look at the suburbs, and closer to 10% when you look at the city of Cincinnati proper. I think, you know, we had this issue recently when Indiana jumped up in the number of positivity rates, and there were a lot of questions that the governor received about, can I travel to Indiana safely or travel back and forth for work? And being a river town right across from Kentucky, I think that does hold true. But, you know, the message doesn't change at all. No matter where you go, if you're traveling, we're asking you to be careful. If you're traveling for pleasure, I'm strongly recommending you postpone it. If you're traveling for work, I'm strongly recommending that you be as cautious as possible and make good decisions. So I don't really think that there's much bearing ultimately if there is a slight discrepancy between that number.
I don't think I have anything to add to that. I agree. 15 is a high number, and whether that's actually 14 or 16, it's still a really, really high positivity number. And we are so close to a vaccine. I just think we, as a community, we just got to buckle down and power through these next couple of months. And I really hope we'll be in a better spot later in 2021.
Either of you know what ingredients are causing the difference in these numbers reported by different states, different agencies?
I'm not familiar. Our health collaborative is successful at capturing the majority of data, and so I feel fairly confident that their number is very accurate.
Thank you, Larry. Our next question comes from Todd Dykes. He has a follow-up question for you, Dr. Rich.
Yeah, Dr. Rich, thank you for one more. First off, I feel like I've seen you, we've probably met, and I apologize that I'm zoning out here. Describe where you work and your practice, and then the question I have for you is, as I think in your unique position as someone who works in the hospitals occasionally, but also as a private practice, you mentioned vaccines, and this is actually a question that for my colleague John London working on another story. Skepticism being expressed on social media about vaccines. We're starting to see these posts, and who knows where they're coming from and the validity and whatever, but it's out there, we know, and there's some surveys that indicate people are concerned about it, not going to take it, whatever. So two things. First off, again, a little more detail about your practice so we will know, and then the question about skepticism that we're seeing online about vaccines.
Yeah, so I'm actually a UC employee, and so I work for UC. I'm an associate professor at UC, and I help run I am the leader, the runner of a training program in family medicine. Although I am here in a kind of personal and capacity and not necessarily representing the views of University of Cincinnati. And then for the vaccine, I've looked at the data for both the Pfizer and Moderna vaccines, and their initial data looks really good. My husband's actually in one of the studies, and so I'm hopeful that it plays out. At the same time, I can certainly understand, especially from communities of color, worrying about the vaccine and the validity of it. They have good reason to worry about those things because of the history of medicine and things, frankly, that we've done that have broken their trust. So I've heard that that's been a question specifically for the communities of color. But I'm sure there are other people who are worried as well about whether this has been enough time. It is a short vaccine trial, but I think we're in an emergency situation. And the initial evidence, both in the laboratory and in the initial clinical trials, looks really good.
Again, let me ask you just real quickly, follow up. What would you like to see as a physician done to try to, help people understand? I mean, you're right. It's a lot of unknowns, and who knows, in 3 years, we're all growing a third left ear because of the vaccine. And let's hope and pray that that's not the case. It certainly doesn't seem to be. But what can be done, right, to try to alleviate some of that anxiety, especially in that, you mentioned communities of color, which I completely understand and appreciate, but especially among those anti-vaxxers that are just flat out, there's that community out there too, that people of all races, and it's just like they're so anti anything, these medical freedom people, whatever. What do you say to that community?
Yeah, that's a hard one as a physician, because I do believe in all vaccines. And certainly I've had patients who believe differently. And, I really just try and meet them where they are and try and work with them over time to address their concerns that they have about vaccines, because I know they're trying to do their best to protect their children, and they're doing the best they can. I think, once the vaccine becomes more widely available to the community, sure, you have a choice to not take it. I would just say that you still need to follow then all these other precautions of, staying home and avoiding large crowds, and so that you aren't contributing to the spread of the infection.
Thank you.
Just add one more thing. First of all, I don't think we have to worry about a third left ear. I think we're in good shape that way. And for those individuals that have questions about the vaccine, I would strongly recommend they consult their physician. People do this all the time, and the physicians will have the best information. If you're concerned because you have an immune system issue and you want to make sure the vaccine is safe, just give your physician a call and they'll work you through that.
Thank you, and that appears to conclude our questions from reporters.
All right, we've had a bit of a marathon here, Jay. Thank you so much, Dr. Rich, for being on. We really, really appreciate your time and your perspective. As always, I'm thankful this morning to Greg Kesterman, the Health Commissioner for Hamilton County, for being here every week, for making sure people in this community have the right information, the right data points, so that we understand what's happening with COVID-19. So 2 last things. The first is that we're hearing a lot about the vaccine from the national level and from the state level. And so we've talked a little bit about EMA. Nick Crosley's been on about accepting the vaccine with community partners, the storage of that, and then the distribution. We'll dig into that a little bit in December as we get closer to receiving the vaccine. So look for that, maybe next briefing, maybe the one following that, and we'll make sure we've got the right people on the call to talk about the vaccine and what it means to Hamilton County and the people in this community. So that's more to come on that. And then lastly, I just want to wish everybody a happy Thanksgiving. Please stay safe and sound. We appreciate you being on, and we'll be back next week. Thank you.